third is the number first is physical incompatibility, second is therapeutic incompatibility, and third is chemical. Number first, physical incompatibility means when two or more substances are come together and the changes will be take place in physical properties and it leads to the unacceptable or undesired product is also called as physical incompatibility. Which changes take place in physical incompatibility? Like a physical changes will be take place in physical incompatibility, like a color, odor, taste, and like morphological changes will be take place in physical incompatibility. And there are 4 methods is included in the physical incompatibility. That is the correction method. Number first is immiscibility, second is insolubility, third is precipitation, and fourth is liquefaction. Number first, immiscibility means when two liquids are immiscible to each other because the incompatibility is occurred. And this incompatibility to overcome or to increase by using the emulsifying agent. For example is peppermint oil, water, and alcohol. Oil and water are immiscible to each other because the incompatibility is occurred, and this incompatibility to overcome or to increase by using a emulsifying agent, and alcohol acts as the best emulsifying agent in immiscibility concept. And second method is the insolubility. Insolubility means when two solid or liquid substances are does not soluble to each other, or insolubility means inability of material to dissolve a particular solvent like organic or inorganic, and this is the incompatibility is occur, and this incompatibility will be increased or overcome by using a suspending agent in insolubility concept. Examples of caffeine, orange syrup, and phenactin are the examples of insolubility. The powder of tragacanth and nucleus tragacanth, these two components are the act as the best suspending agent to make a stable suspension in insolubility concept. And precipitation means when a drug is precipitated into the solution, they are insoluble to each other because the incompatibility is occur. And to overcome or to increase by using a continuously stirring process occurs in this precipitation. For example, is tincture benzoin compound. Tincture benzoin compound contains resins. Resins is a sticky flammable organic compound, and it is insoluble in water, and this is exhausted from some trees and plants. And tincture benzoin compounds contains resins, and resins are insoluble in water because the incompatibility is occur, and this incompatibility to overcome or to increase by using a continuously stirring, and it produces to be the lymph. And fourth method is the liquefaction. Liquefaction means when certain solid or liquid mixtures having a low melting point or soft mass is also called as to be the eutectic mixture. Why some solid or liquid mixtures having a low melting point? Because some solid or liquids having a low melting point or below the room temperature and hydration reaction takes place in the liquefaction, and this incompatibility to overcome or to increase by using a thickening agent in liquefaction methods. And examples is camphor, menthol, thymols are the examples of liquefaction. And second types of incompatibility is the therapeutic incompatibility. Therapeutic incompatibility means when two or more substances are comes together, then the changes will be take place in the therapeutic property. It is also called as to be therapeutic incompatibility. And these are the 5 concepts included either in overdose, wrong dose, contraindicated drugs, synergistic and antagonistic, and 50 the drug interaction. These 5 concepts is included in therapeutic incompatibility. Number first is error in overdose. Error in overdose means sometimes medicines are available in solid dosage form, liquid dosage form, capsule medicines, and few cases error is occurs. Hence it becomes a duty of pharmacist to check and clarify the prescription before dispensing on it. For example, is atropine sulfate gives a 0.03 gram, phenobarbital gives a 0.06 gram, and aspirin gives a 0.300 gram. These 3 grams comes and you make a 10 capsule, but you make a more than 10 capsule or you make a less than 10 capsule. This is error is occur, and hence it becomes a duty of pharmacist to check and clarify the prescription before dispensing on it. And second is wrong dose. Wrong dose means when certain drugs which have a similar name or same pronunciation, but these drugs are different on it. And for example, here prednisone, and other is digoxin and digoxin, and third is contraindicated drugs.
At what stage you are going to this
incompatibility recognition is very important because the pharmacist work to purpose the medication and to avoid the harmful or unwanted administration of drugs. This is the main role or main function of pharmacist, and to check the prescription and to clarify the prescription then before dispensing is main role or main concept of incompatibility.
Okay, so you are checking the incompatibility, and you said that there are these number of factors that you need to consider. But suppose if you have one medicine which is not expired, but you think that there is some problem, what should you do in that situation?
Some medicines does not expire in manufacturing date, but few errors is occurs, and this is a barrier is occurs. This medicine does not use in any person or prescribers.
The blood circulation is maintained by the whole muscular for the heart is linked with the blood vessels. The blood vessels are the two types. First one is the vessels which collected the blood from heart, blood from other body parts, and the ATM with the contents in the heart. The term is called as the vein, and the second one is the vessels collected blood collected by the heart from the heart and to other body parts. The term is called as the arteries. The heart is 10 centimeter in length. The weight of heart in male is 310 gram and the female is 225 gram. The heart is a very most important organ of the human body. The heart is pumps the blood and to maintain the blood pressure. They provide the nutrition and the oxygen to the cell. Heart is a soul chamber, two atrium and the two nucleus. The heart divided the left side and the right side by the fibrous segments. By the fibrous one is the right atrium and the left side. The heart has a full wall that permits the flow of the blood into the flow of the blood in only in one direction and prevent the backflow of the blood. The two atrium and ventricles is also called as the atrioventricular. The right AV walls is also called as the tricuspid wall.
Thakur College of Pharmacy to present the question about the skeletal system in our body. Skeletal system, first there are the skeleton and tendon. The skeletal system are divided into two parts: axial skeleton and appendicular skeleton. Axial skeleton consists of 80 bones and appendicular skeleton consists of 126 bones. In the children, the 300 bones are present, and in the later they merge together to forming adults. Not 6 bones are present. And in axial skeleton, 80 bones are present.
Today is my topic is diabetes. First, what is diabetes? Diabetes is nothing but the higher sugar level in blood. There are two types of diabetes: diabetes mellitus and diabetes insipidus.
My name is Siddhan Naramali. My participant I am studying in the pharmacy of the College of Pharmacy. Today my topic is Krebs cycle. Krebs cycle is discovered by Dionysius in 1937. Oxidation process in which citric acid cycle as a series of reactions is known as.
First of all, my presentation of Krebs cycle is one photographs has been performed from pyruvic acid, and this pyruvic acid does not participate in the Krebs cycle. There is a pyruvic acid that is converted into two carbon compound that is acetyl coenzyme, and this acetyl coenzyme is converts into
My name is Sinan Umar Safeli, currently studying from second year at Lago College of Pharmacy second year. Today on Occasion Pharmacy Day, poster presentation and my topic is HPLC. That is basically nothing but high pressure liquid chromatography.
Solvents that can be used with single reaction.
सॉल्वंट मध्ये सर आपण ऑर्गॅनिक सॉल्वंट यूज करतो, त्यामध्ये इथर असेल, क्लोरोफॉर्म असेल, एक्सेट्रा. मोबाईल फेजमध्ये ते लिक्विड यूज केलं.
First section of hot air one. Hot air one, it is made up of double-walled chamber. It is made up of double-walled chamber in steel. Thermometer to detect the temperature. Slaves are present. Slaves are fixed in the hot air one to place the material for sterilization and working. This is the fan. Fan is the present for uniform circulation of hot air.
Advantages of hot air one. No need to water for sterilization of a material. Then the exposure of method is suitable for sterilization of equipment such as a glass cylinder due to exposed to higher temperature for a long time. Then second one, it is not damaging to glass and metal equipment as a moist temperature.
Today's our poster presentation
presentation topic is autoclave. Autoclave is machine. Autoclave is a machine which is used to sterilization of medical or surgical instrument. The autoclave is based on the principle of moist heat.
The advantages of autoclave, it is used to sterilize. It is used to sterilize large number of official injection. After that, a large quantity of material can be sterilized in one batch of using big autoclave. After the disadvantages of the autoclave is it is unsuitable for sterilizing powders and oils.
On the occasion of World Pharmacy Day, our college organized a poster presentation, and our poster presentation topic is fall meal.
Firstly, principle. Fall meal is work on the principle of combined impact and addition.
The next point is advantages. We know that fall meal is used for the size reduction. So fall meal is used for the getting the fine powders. The maintenance is easy. The low operating cost and installation is easy. It is used for both wet and dry grinding. The wide varieties of material which can grind this meal, and it can be continuously operated with the attention classified with the meal. Then the next point is the uses or application.
On which principle it is based?
Impact and attrition.
Impact and
Attrition.
what is the difference between impact and attrition?
Impact means the force are acting in one side of the material, and attrition means both sides, right side and left side force are affected on the material.
What is the disadvantages of that ball mill?
It is a noisy machine, and it can it is noisy machine. Wear occur from the ball and casing, which may cause contamination of the ball. And the use of the ball mill is it is used for grinding the brittle particles to get fine powder.
The common parts are respiratory system and digestive system. The common parts common parts mouth, larynx. I am the recruiter in B.Pharmacy second year in Latu College of Pharmacy, Asegam. I am glad that I have got good opportunity for this presentation. Today, my topic today for this presentation is qualitative analysis of given unknown compound. There are four tests. Firstly is the preliminary test, secondly is solvent test, thirdly is detection of element, and fourth is
Composition of blood. त्यामध्ये whole blood divided into two types, plasma and format element. So plasma is a plasmic blood. Plasma is a liquid, yellowish liquid. Component of blood. In our body it present in 55%. Plasma is a sub-classified into 6 types. त्यामध्ये amino acid, nitrogenous base, nutrients, electrolytes, and proteins and gases.
I am Virisha Kanya Ganesh. I study in diploma second year at Latu College of Pharmacy. The root of administration classified into two types: systemic and local. Systemic classified into two types: ventral and parental.
Foldscope technology. Foldscope is a newly developed type of microorganism microscope for the in 2012 by Manu Prakash, managing author and Pamela. So this is the foldscope, newly invention of microscope. It is nothing but just a type of microscope. A foldscope is the ultra low cost origami based for large scale manufacturing of microscope. Ultra low cost is nearly about 50 to 1800 rupees. And origami based means it is the origami is the art of paper folding. Then especially it is demonstrating bright field, dark field, and fluorescent microscope. I am Ms. Payal Jadhav from B.Pharm third year.
And I am Miss Anjali Masti from B.Pharm third year.
And our
topic is hypertension and antihypertensive drugs. So first of all, the question rises, what is hypertension? Hypertension is either increase in systolic blood pressure more than 140 mm of Hg and diastolic pressure greater than 90 mm of Hg. So our normal blood pressure is generally systolic is 110 to 130 mm of Hg and diastolic is 75 to 80 mm of Hg. When there is increase in this normal BP, hypertension takes place. This is the pathogenesis of renin in hypertension. Mainly in this, angiotensin, renin and aldosterone are the main hormones for the pathogenesis of hypertension. By using some of the pictures, we have explained the causes, symptoms and treatment and prevention for hypertension. These are the causes. It is caused due to hereditary problem, fat and salt-rich diet, obesity, excessive stress. Symptoms are feeling dizziness, nausea and vomiting, persistent headache and protein in urine. Treatment and prevention are take proteinous diet, take a walk, exercise regularly, take prescribed medicine and do not drink or smoke. Besides this, there are some antihypertensive drugs which are used for the treatment of hypertension. This will be explained by my friend Angelina. So first of all, we will see what are antihypertensive drugs. Antihypertensive drugs are those drugs which are used to normalize the high blood pressure. So these are all the classes of the antihypertensive drugs. So first of all, we will see diuretic antihypertensive drugs. So diuretic antihypertensive drugs are those drugs which are acting on the urinary system. So these increases the elimination of water along with sodium ion, chloride ion and sometimes bicarbonate ion also. For example, thiazidine. So next one is centrally acting agents. So centrally acting agents are also called as centrally acting sympathoplegic agents. So what are sympathoplegic? So sympathoplegic agents are those agents which causes the paralysis of sympathetic nervous system by centrally acting on the brain. For example, methyl dopa. Methyl dopa is used to decrease the high blood pressure. So next one is beta adrenergic blockers. So beta blockers are also called as beta adrenergic blockers. So these are also used to decrease the hypertension. For example, timolol. So timolol, this medication is used to decrease the high blood pressure. By this is in the disease where ocular hypertension causes due to the pressure in the eye due to glaucoma. So this medication is used. So next one is angiotensin converting enzyme. So angiotensin converting enzyme. In angiotensin converting enzyme, angiotensin drug is used to decrease the high blood pressure.
Okay, so this hypertension is considered as silent killer because in long run it affects many organs. So what we should do to decrease the population of patients associated with this hypertension?
So regular exercise is must and proteinous diet is must. And proper medication. If a patient is suffering from any kind of symptoms related to this, they should take medication from the doctors.
What is the normal range of
120 by 80 is
I'm Radhi Margaret Reddy from BCom final year, and this is our topic, Zolgensma, and it is guided by Mr. Vasudha. Zolgensma is a neuromuscular drug, BP, which is given intravenously in the very rare disease. The drug is recently approved by FDA in 2019. The disease is spinal muscular atrophy, in which neurodegeneration occurs of spinal cord, in which strengthness becomes low and motility decreases, and also motor nerves get damaged. For this treatment, Zolgensma is a drug which is approved by FDA in 2019, which is given intravenously, and which is world's most costly drug, that is 16 crore per drug. Normally, SMN1 gene, affects that SMN1 gene. Normally, if it is present, it codes for the survival motor neuron protein, which is needed for the motor neuron cell survival, in which it leads or responsible for the communicating with our muscle and essential essential for the work on functioning of the muscles. And if it is absent, it will not code or it will not produce the survival motor neuron protein, in which it will lead in motor neuron loss with strength, and eventually their function will be lost. And Zolgensma is having the copy of a human SMN gene, and in SMN new gene, it is in the adeno-associated virus 9, which act as a carrier towards the carrier to the body. It delivers it to the motor neuron cell in the body, and this new SMN gene becomes the part of the DNA of the patient, and which leads to the proper functioning and production of the SMN protein.
There are some symptoms of this spinal muscular atrophy, that is our swallowing problem decreases, but the first type is more fatal and in occurs in the children below 2 years old.
Specifically, this drug doesn't bring back any lost motor neuron function. It just helps in maintaining the function of the non-dead neurons and expands the life of that patient or a child. And specifically, this disease caused, or this disorder is caused only below the 2-year children only.
Type 1 disorder.
And this SMA spinal muscular atrophy is originally described by the first 2 infants. Those were brothers, and by the widow Werning in 1891, when there was no medication or treatment was there. And the first case in India was found in Jaipur in J.K. Lone Hospital, and that boy name was Priyanshu Mathur. And eventually in the survey we found that nearly 800 children were suffering for SMA in India, and thrice as many dies before their second birthday. And early 2 cases were arised in Secunderabad, August 2020 and 2021 in the Rainbow Children Hospital. In this, the medication was provided by the Novartis and free of cost on a humanitarian ground basis.
After all this, there is one side effect which is which damages the liver, and this side effect can be reversed because can be cured because after giving corticosteroids before the Zolgensma drug, and also after giving the Zolgensma drug.
Any questions, sir?
Dr. Jones.
Thank you so much.
This came in the highlight due to KBC.
Yes, KBC, and of course more actors were there who were appealing for the donations also.
Paper cuttings.
So how you can reduce the cost of that injection?
We can't reduce the cost of the because before getting the patent, the whole preparation cost they have to renew it. Therefore, the cost is high.
Yet it is.
Good afternoon, sir. My name is Sandra Vaishnavi from B.Com Today we are here for poster presentation, and the highlighted topic of my presentation is unusual medicines are dangerous. The main motto and the main view of my presentation is the beware. Beware means caution and alert and danger. Beware means precaution to the people from unusual medicines. Unusual medicines, those medicines are expired, and those are unfavorable and unintended for those uses. So for this beware, the most important factor is the always dispose of unusual medicines. Disposal means there is getting rid from those medicines which are not used for future use and not used for the continuous use, which are the most harmful effect to all human beings and misleading to people. So there is a need to be a disposable of such type of medicines. Next, there is a most important also drug storage. For drug storage also matters in the unusual medicines. In that first, proper drug storage environment, drug store room and the dispensary. Drug storage, there is the contaminant-free environment is needed for the storage of drug, and some environmental factors where the chemicals, where our drugs are chemically stable and they
What we should do with expired drugs?
dispose.
How to dispose?
There are disposing methods.
Example.
We can flush it and we can dump it, and also coffee grounds, plastic bags.
Komal Bogwan from B Pharmacy third year.
Myself
Bangladesh Sababan Rao. I am from Alsubi from third year.
We heartily welcome you, sir, on the behalf of Latur College of Pharmacy. On the occasion of World Pharmacy Day, our college has organized the poster presentation. In that poster presentation, our topic is that pharmacology of acetylcholine. Let's review towards the introduction of acetylcholine. Acetylcholine is the abundant neurotransmitter which is present in the human body, discovered by the great scientist which is Bayer in 1867. Neurotransmitters are the chemical messengers which transmit the impulses from one neuron to another neuron. The structural formula is acetylcholine is C7H10NO2 and the chemical name, scientific or IUPAC nomenclature of the acetylcholine is 2-acetoxy-NNN-trimethyl-ethanamide.
Types of receptor. Acetylcholine is having the two types of receptor. That is the muscarinic receptor and nicotinic receptor. Muscarinic receptor having the 5 subclasses M1, M2, M3, M4 and M5. In that the 3 receptors are mainly characterized. That is M1, M2, M3. M1 we will see the location and effect of the muscarinic receptor in which M1 receptor are present in the smooth muscle. Acetylcholine stimulate the action of muscarinic receptor present on the smooth muscle of the respiratory tract, urinary tract and eyes. They produce the excitation of the smooth muscles. Second one is the M2 receptor. M2 receptor are present in the heart.
Do you know any disorders or disease?
Alzheimer's disease and Parkinson's disease. Decreasing the level of acetylcholine, they produce the Alzheimer's disease, and increasing the level of acetylcholine, Parkinson's disease.
Myself, Degali Pratisha from B.Com third year. Myself, Lumani Kanti from B.Com third year. Happy Pharmacy Fellowship. On the occasion of Pharmacist Day, we choose the topic green chemistry. Chemistry is used in the everyday life, but in this the unique topic is green chemistry. Green chemistry is also called as sustainable chemistry. Sustainable means up to a certain limit or reduce the effect of hazardous substances, in which designing of products and processes that minimize the use and generation of hazardous substances. That is the main purpose or motto for the green chemistry. Whereas environmental chemistry focuses on the effect of polluting chemicals on the nature, green chemistry focuses on the environmental impact of chemistry, including the technologies, approaches to preventing the pollution or the environmental issues. In 1998, Paul and Estes directed the green chemistry program at the US EPA, United States of Environmental Protective Agency.
Mainly the study of the machineries, most of the important of the what is the principle of the machine. So the collider principle is consisting of the two discs. One disc is a rotor and another is a stator. Rotor. We know that its name is a rotor. Rotor means they are acting as a rotating.
You are choosing this topic.
Because sir, I was interested for the machinery studies.
Pharmaceutical manufacturing size reduction is one of the most extensively used size reduction is a process large
First of all, happy Pharmacist Day. My dear students, and आजचा जो इव्हेंट झाला तो पण छान झाला आणि असंच तुम्ही तुमच्या लाईफमध्ये प्रत्येक इव्हेंट्समध्ये पार्टिसिपेट करून असंच मला खुश करत राहावं अशी अपेक्षा आहे. आणि एनी गेस्टेड स्टोरी असेल डिप्लोमा फर्स्ट प्राइज किती आहे फर्स्ट प्राइज 5,000 goes to रासुरे ज्ञानेश्वर. सेकंड